For our project, we decided to examine the relationship between healthcare spending and overall population health as measured through life expectancy. We were interested to see whether quality of care is impacted by the levels of government and private spending, specifically due to the fact that private is subjected to income inequality and varied care quality. We first took a broader approach and looked at government health spending percentage in relation to life expectancy. The percent of government expenditure is defined as the percent of a country's total expenditures that is spent on health services, which is sourced from the World Health Organization. The data ranges from 1995 to 2010. Across all data points, a slight positive correlation is seen between higher percent of government spending on healthcare and higher life expectancy. Sub-Saharan African countries in general seem to lag behind the rest of the world in life expectancy with similar percents of government expenditure on healthcare. Looking specifically at the United States during this time period, we see life expectancy increase by about a year for each 5 years. The percentage of government spending also increases over this time, increasing by a larger percent change each 5-year increment. Similarly, we see a large increase in life expectancy with increased government spending over the same time period in Rwanda. In 1995, Rwanda had just exited a bloody civil war and genocide that ravaged the country. Since that time, the country has been able to rebuild and begin to develop. Despite the positive correlation between life expectancy and the percent of government spending on healthcare, we cannot assign causality between the increased spending percentage and increased life expectancy because of the major effect of economic development on the country. Contrastingly, we look at Brazil, a country that experienced a lot of economic development over the same period. Brazil's life expectancy increases each 5-year period. However, their percentage of government spending on healthcare is halved and stagnates before increasing again. This suggests that there are more factors to life expectancy than government spending on healthcare. Next, we looked at the correlation between private share of health spending and life expectancy. The percentage of private health expenditure encompasses the percentage of costs that have been paid by private entities, such as commercial insurance and out-of-pocket payments. Looking from 1995 to 2010, within the first 10 years, we see quite a bit of fluctuation in most countries' private share investment in healthcare. However, around 2005, the general trend moves toward a reduction in overall private share spending around the world. It is also important to note that the data shows a negative correlation with percentage of private share spending and life expectancy, suggesting that other factors may have carried a greater weight in contributing to better health outcomes. Looking specifically at the United States, from 1995 to 2006, the percentage of private share spending remains relatively constant at 55 to 56%, mirrored by a 2-year increase in life expectancy from 75.9 to 77.9. However, by 2010, the percentage of private share spending drops to 46.9%, but still coincides with another 1-year increase in life expectancy. Brazil is an example of a country in which percentage of private share in healthcare remains constant within the range of 53 to 57%, yet from 1995 to 2010, the country experienced a 4.5-year increase in life expectancy. If private share of spending is constant, an increase such as this can originate from a number of other sources, such as improved medical technology or increased measles vaccinations. On the other hand, in 1996, Iraq was a country in which almost 100% of health spending was being paid by private entities. However, the turn of the century brought years of war and economic sanctions, resulting in a sharp decline in Iraq's GDP and a drastic decrease in the percentage of private share spending down to 19% in 2010. Despite an 80% decrease, life expectancy rose by 2 years, indicating the role of other factors in predicting health outcomes. Life expectancy seems to move independently of percentage of private share health spending, leading us to believe that it's not the best indicator of health. Lastly, we wanted to look at total healthcare spending and see if what we saw in private and public spending can be explained simply by more money is associated with higher life expectancy, or if one is more effective than the other. For this analysis, we used the data for average total health spending per person in US dollars. The data for this graph shows a consistent upward trend with countries who spend more money on healthcare consistently have a higher life expectancy. This data was collected from 1995 to 2010. When at the same time, countries increased their spending per person considerably, especially countries who were in the low to moderate spending range. The United States spending per person over this time increased from $3,750 per person in 1995 to $8,360 per person in 2010. While spending went up 123%, life expectancy increased from 75.9 years to 78.7 years, a 3.6% increase. The U.S. is a good example of a well-developed country increasing healthcare spending to try to increase the general health of a population that is already healthier than most other countries. Additionally, we wanted to look at a developing country and see the effectiveness of their spending relative to a highly developed nation like the United States. India is a country that we know has gone through drastic changes in their population, growing rapidly every year. In 1995, India spent only $15.7 per person, increasing to $54.3 per person in 2010, a 245% increase. This went with the life expectancy increasing by 8.8% from 60.8 to 66.2 years. Compared to the United States, India's spending increases had a much greater correlation with general population health. While we cannot draw a direct connection between total spending and increases in life expectancy, the data suggests that increased spending leads to increased life expectancy with diminishing marginal returns.